In Brussels, children are breathing cleaner air, and diabetes rates seem to be shifting as well. Could city traffic rules be having a bigger impact on our health than we thought?
Today is May 23rd, 2025. Let's start simple. Low emission zones, or LEZs, keep high-polluting vehicles out of city centers. But there's more happening in places like Brussels and Antwerp than just better air quality, right?
Exactly. A recent Belgian study found that after Antwerp and Brussels set up their LEZs, Antwerp in 2017, Brussels in 2018, not only did air quality improve inside the zones, but neighboring areas saw benefits too. Sometimes, the air even got cleaner just outside the zones. For instance, in Brussels, nitrogen dioxide dropped from about 29 to just under 19 micrograms per cubic meter over 5 years. Black carbon levels nearly halved.
That's a significant change. But when it comes to people's health, did the researchers actually see fewer asthma attacks or heart problems?
Here's where it gets interesting. Most health measures didn't really change except one: diabetes. The researchers tracked how many people were prescribed diabetes medication. Inside Brussels LEZ, the rise in anti-diabetic prescriptions was slower compared to areas outside the zone.
Wait, diabetes? So air pollution is more linked to diabetes risk than, say, stroke or asthma?
Exactly. According to the European Environment Agency, nitrogen dioxide is especially linked to diabetes risk, even more than stroke or asthma. The idea is that reducing exposure to NO2 could help delay or prevent diabetes.
How does that work biologically? What's happening in the body?
Pollutants like nitrogen dioxide and fine particles trigger inflammation and oxidative stress, which disrupts how the body manages insulin. They can even harm the cells that produce insulin. In Brussels, NO2 levels dropped from about 30 to 18 micrograms per cubic meter, so people there were exposed to less of a known risk factor for diabetes.
That makes sense. But did these health benefits show up right away, or did it take a while?
It took some time. The study looked at data from 2017 to 2022. Air quality improved fairly quickly, but the drop in diabetes medication needs became clear after about 4 or 5 years. Chronic exposure is key here. The effects build up gradually.
And what about inequality? Did these zones only help wealthier neighborhoods, or was the impact broader?
Good question. The study mapped out deprivation across neighborhoods. Even after the LEZs, deprived areas still had more pollution, but they saw the sharpest reductions. Nitrogen dioxide fell more there than in affluent areas, so the zones actually helped close the gap in environmental health.
That's promising. Were there climate benefits as well?
Yes, if Brussels continues with its LEZ plan, emissions from road transport could drop by 45% by 2030. Between 2019 and 2040, the LEZ is projected to prevent almost 4 million tons of emissions, the equivalent of taking 83,000 petrol cars off the road.
Besides air and health, do these zones change daily life in other ways, like how people feel or work?
Evidence from London's ultra-low emission zone suggests they do. After it launched, sick leave dropped by nearly 19%, and respiratory absences by more than 10%. People living near the zone reported feeling better and more satisfied with life.
But not everyone supports these zones, right? What's the main pushback?
Economic worries are the main issue. Lower-income residents often own older cars and might struggle to replace them. Small businesses worry about losing customers or facing higher costs. In Brussels, some political groups want to delay the next phase of LEZ rules because of these pressures. But the study points out that with the right support, LEZs can actually help reduce, not increase, inequality.
So to sum up, cleaner air, slower diabetes rise, narrowing health inequalities, and lower emissions. But there are still political hurdles. What's the main takeaway?
Local policies like LEZs can have broad effects on health, equity, and climate. The evidence is strong, but sticking with these changes and making them fair is what really matters.
That brings us back to where we started. Children breathing easier with a healthier future ahead. Thanks for listening.
Thank you for joining us. This episode was brought to you by mynews.studio. Try it now for free